warahmatullahi wabarakatuh. Selamat malam. Good afternoon, everyone. Hello, my name is Dwi Ayuningrum. Hello. My name is Dwi Ayuningrum. I'm student from pharmacy, student of Universitas Muhammadiyah of Yogyakarta. Now I will present about my research paper entitled Doctor Prescription about the important role of pharmacies in healthcare. First, I want to talk about the table of content in my paper. So I will discuss about the background or introduction, the literature review that I used, the research method, the result of my finding, or a discussion about the data that I have obtained, and finally the conclusion. First is conclusion. Currently, pharmacists are one profession has a role in community service in the field of health. But until now, the role of pharmacists is still not important. It is the pharmacist who is the most competent or the person knows best about ins and out of the pharmacist or should ensure that patient get the right medicine used in the right way and used in the according to what is expected. About the pharmacist further role at this time, the study is the study of rural pharmacist role in the quality of health service for the community. The purpose of this research is also the increased public awareness, the importance of role of pharmacists, and also the research will inform doctor or medical student who discuss a major role of pharmacists in the process of providing health service in the community. Next is literature review. Previous research that has similar topic is about the important role of pharmacies in healthcare. First, from Lidianto's research, state that the level of patient satisfaction with drug information services at the Banyumas Region Health Center states that 5.3% of patients are very satisfied, 33% of patients are quite satisfied, and others dissatisfied with information service at the Puskesmas. This shows that the existence of pharmacies of drug information service Puskesmas is very important. Next, literature review from Aditya Putra, the study entitled Health Workers' Perception about the Role of Pharmacists in Clinical Pharmacy Services. This study showed that health workers, both group of doctors and nurses, agree with the role of pharmacists in clinical pharmacy services. And the last literature review that I used to my paper from Savitri, the result of his study showed that 93% of doctors already consider pharmacists as partner in the implementation of health services. This shows that the pharmacist and the doctor have established a good cooperative relationship. With a good relationship of cooperation and communication between the pharmacist and the doctor, it will affect improvement of health service provided to patient. Next, the method. The study used interview to find out how important the role of pharmacists is from the perspective of medical student. Qualitative research is based through analysis interview were conducted for medical students of various generations, who were of different generation and who were of a different gender when interviewed. The age of the respondent reached 12 years to 24 years at the time of the interview. To able to take part in this research, they are required to fulfill two criteria. One, a medical student of Yogyakarta Muhammadiyah University, And two is understand or fully know the flow of health services in a hospital, select a medical student because doctors who have a big role in health service with other health workers, pharmacists in particular. Next, also the purpose of the study is to discuss the relationship between the role of pharmacists and the quality of health service. This study addressed the following question. One, how is the role of pharmacists in supporting health service together with doctor and other health professional? Two, what doctor think about the skill that pharmacists have to provide health services? Three, how does the effect of health service if the role of the pharmacist is removed? And four, how doctor think about pharmacists should be directly involved in all decisions relating to pharmaceutical service and drug use. And the last is respondent expectation of pharmacists in the future can be specialized and cooperated with specialist doctor. Now we move to result or finding. Question number one, respondent opinion about the important role of pharmacists as a professional they engage in the scope of medicine and is fully responsible for the service of drug and medical device. This show that almost all respondents already know that the scope of work of pharmacists include the management of drug and medical device. The real work of a pharmacist is not just make or mix a drug, but also to ensure that the medicine made or delivered is used correctly by the patient. It is hoped that these service activities will also include providing information about the rules of use, dosage, and side effects of drug use, as well as monitoring and evaluating the use of drugs and medical device to patient. Question number two is respondent opinion about the skill that pharmacists have to provide health services. Pharmacy service are one of the activities in hospital that support quality health service. The aim of pharmacists to maximize the therapeutic effect, minimize treatment waste, and minimize treatment cost. With knowledge and skill regarding good medicine that should be possessed by pharmacists can help doctor and other medical personnel in handling patient treatment problems. Question number three is respondent opinion about the effect of health service if the role of the pharmacist is removed. In this study, the three respondents agreed that existence of pharmacists is very important in supporting health service. If the role of pharmacists was eliminated, research and the pharmaceutical will stop or even retreat. The fourth question is respondent opinion about pharmacists must be directly involved in all decisions relating to medical service and drug use. The results show that throughout the respondent answer agree. This may be because a respondent assumed that the pharmacist, the scope of his work in the field of medicine, so that with the involvement of pharmacists in the formulation of all the decisions relating to pharmaceutical service and drug use is expected to help by providing advice or input determining appropriate therapy for patients to ensure treatment rational. And the last question is respondent expectation of pharmacists in the future can be specialized and cooperated with specialist doctor. In this study, two of three respondents agreed that in future pharmacists were specialized because this will make the pharmacist more focused on his field of work, but there is one respondent who answered disagree. This may because the respondent has not able to accept if the pharmacist goes to a particular field of specialization, such as a doctor, and there is also the possibility of the respondent not understanding the benefit of this pharmaceutical specialization. Now move to the discussion from question number one. Important role of pharmacist as a profession that engage in scope of medicine and is fully responsible for the service of drug and medicine and medical device. The result of the question about the important overall of pharmacist according to doctor in the study as well have in common with previous study conducted by Hidayat at Prof. Hospital Dr. Margono Soekarjo Purwokerto, whereas many 50% of physical respondents agree or strongly agree the statement about the role of the pharmacist in providing education, Occupation including the selection of drug without perception, and the role of the pharmacist is providing advice and evaluating perception within a doctor. Question number 2 is as for the question respondent opinion about the skill that must be possessed by pharmaceutical to provide health service in the study obtained results similar to previous study conducted by ISES et al. In another country, explained that the decision made by pharmacists to work with doctor in therapeutic care service would provide clinically reliable and maximum result. And the pharmacy decision is also influenced by the pharmacist's ability to handle health problems, so that the ability of pharmacists, both soft skill and hard skill, is needed to improve health service. Next is question number 3. The effect of health service if the role of the pharmacy is removed. Then the result from the opinion of doctor about the effect of health service is if the role of pharmacy removed. In the study obtained result similar to previous study conducted by Stephen et al., which state that teamwork is a group of teams that produce higher performance than the number of individual input. Teamwork can produce positive synergy through coordinated effort. A doctor and pharmacist have different scientific knowledge, so collaborating between the two professions can improve health service in hospital. It should be emphasizing that the pharmacist is a colleague who will help the doctor in accordance with the authority to achieve optimal patient care. If doctor and pharmacist as professional worker can work together, then the patient health goals can be achieved. If the role of the pharmacist is eliminated, there will be a setback in health service, especially related to drug. Question number 4 is opinion about pharmacists must be directly involved in all decisions relating to pharmaceutical service and drug use. Furthermore, the result of the respondent opinion about pharmacists must be directly involved in all decisions relating to pharmaceutical service and drug use in the study, which showed 2 out 3 respondents agree if the pharmacist must be directly involved in the decision making with the doctor. This is different from the research previously conducted by Manurung, showed that there was poor reception from other health workers, doctors, and nurses for some of the roles of pharmacists in hospital. The results show that doctors disagree if pharmacists make drug choice and drug regimens. And the last question is doctor expectation of pharmacists in the future can be specialized and cooperate with specialist doctor. Then the result of the doctor expectation about the pharmacist in the future can become specialized and collaborate with specialist doctor. The result of the study are aligned with the result of previous study by L. Matowe et al. That most doctor expect pharmacists to become drug therapists and extensive knowledge to educate patients about the use of safe and appropriate drugs. Okay, the last is conclusion. According to the study, it can be concluded that doctors agree with statement about the important role of the pharmacist in providing education, including drug selection. In this case, pharmacy is also required to have the ability to deal with health problems. So, the ability of pharmacists, both soft skill and hard skill, is needed to improve health service. If doctor and pharmacist as professional workers can work together, then the patient health goals can be achieved. If the role of the pharmacist is eliminated, there will be a setback in health service, especially related to drug. In making decisions together with pharmacists, doctors should be involved to support the success of treatment for patient. So thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.